Hello. Today I'm going to be talking about hypnotherapy, which seems to be the redheaded stepchild of the psychology world. I'm going to start with a little bit of history, and it's a little difficult because hypnotherapy has roots, like many alternative therapies, in Eastern medicine and Middle Eastern medicine from as far back as we can tell as about the 16th century BC. So, knowing that, I'm actually just gonna kind of ignore that now, just because its roots are so difficult to trace, and I'm gonna focus on the kind of modern figureheads of hypnotherapy. And the first major one, I guess we could call him the father of hypnotherapy, is Anton Franz Mesmer, in the 18th and 19th centuries. He was a doctor and an astronomer, and a very well respected doctor and astronomer. Um, and the way Mesmer treated people is that he would give them, in the beginning of his career, he would give them iron pills to swallow, and he believed that he could rid them of their ailments using magnets. So, moving the iron around the body, he could kind of rid them of these physical diseases. And he referred to these forces as animal magnetism, and he could manipulate that magnetism with actual magnets. He sort of strayed from the iron pills a little later because people started to question that, and the medical world started to question that, and really just kind of resorted to giving people magnets themselves and giving them to them and sitting through these ritualistic ceremonies, trying to basically suck these diseases out of them. So he was really operating on the power of suggestion, which is also referred to as the placebo effect. So, just kind of another reason why many people are skeptical about hypnotherapy is that the father of it all was operating on the power of suggestion. Um, his predecessor James Braid was a surgeon and philosopher, and he used hypnotism to facilitate medical intervention. So he, as a surgeon, was convinced that hypnotism had anesthetic kind of effects on his patients that would allow him to go in and operate on them, which we'll discover in a couple minutes actually may have some efficacy in modern medicine. He was a little bit less mystic than his predecessor, and focused on the physiological effects of hypnotism. Then there's Jean-Martin Charcot, who focused on the neurological effects of hypnotism to treat people in hysterics. His predecessor, one of his students, was Sigmund Freud, which we know from a few lessons earlier this semester. So, Sigmund Freud was focused on memory recovery, using hypnotism for memory recovery, and mostly its psychological effects instead of its physical effects, like most of his predecessors. And he believed also that it was good for abreaction, which is the release of repressed emotions associated with the memories that he could recover with his patients. Now, we'll find out in a little bit too that hypnotherapy in modern times isn't recommended for memory recovery because it's not reliable. Then there was Milton Erickson, who was kind of the first to come up with new physical techniques of inducing hypnosis. And his most well-known one was his handshake technique. So, little do people know that the American Medical Association actually approved hypnotherapy as a real medical therapy in 1958. The American Psychiatric Association followed a little bit after in 1961. And since then, Hollywood has kind of sensationalized hypnotism. So hypnotherapy has kind of received a bad rap for that. Now, it's important to talk about the difference between hypnotism and hypnotherapy. Hypnotism is the inducing of an hypnotic state to facilitate hypnotherapy. And so it has grown in popularity in the 21st century. as another kind of alternative therapy that people can add into their repertoire to supplement more traditional um, therapy with a psychotherapist. So, what are the indications for hypnotherapy? What warrants hypnotherapy? Well, on the psychological side, there's depression, anxiety, stress, sleeping issues, and phobias. And then there's also been some efficacy or suggested efficacy with chronic pain, people who are about to get surgery, and irritable bowel syndrome as well. On the behavioral side, it's been shown to help with some people lose weight, smoking cessation, and cope with and fix eating disorders. Now, it's really important to mention that it's contraindicated if people are actively having hallucinations, delusions, they're in a manic state, they are in a state of drug-induced psychosis, and it should not be used, again, as we talked about with Freud, who believed it should be used for memory recovery. It should not be used solely for the recovery of repressed memories, because there's been studies to show that those memories are not usually accurate. So that kind of leads me to the point of who is most prone to get hypnotherapy, or who could this be most effective for. And it's been shown that people who are extroverted and that are open to new experiences and that are prone to fantasy, whether it's being entertained by fantasy or doing activities associated with fantasy in their daily life, are especially prone to the power of suggestion, as Mesmer would have called it. And this, in one study that I discovered, their susceptibility was determined by an objective measure called the Stanford Hypnotic Susceptibility Scales that measures their level of these characteristics. So what are hypnotherapy sessions? What do they consist of? According to Heather Freilich, who I interviewed with, and we'll see a little piece of the interview at the end of the presentation, most costs of sessions are about $100 to $300, depending on if it's an initial assessment or if it's a return visit. It also can depend on diagnosis as well. It is covered by some insurance providers, but what's covered, who covers it, is varied greatly in my research. And it's dependent on diagnosis. So depression for some insurance providers is covered more than others. The length of each session is 60 to 75 minutes on average. That's at least what Heather reported to me. And in her sessions, it starts with a 30-minute hypnosis, so a guided visualization to induce hypnosis to facilitate the therapy. She describes this as moving the conscious mind to a relaxed state, almost like a deep sleep. And then she can kind of go into a diagnosis-specific protocol, of which she has many, where she can kind of use the power of suggestion to help people address their subconscious mind and make real behavioral change. Following the diagnosis-specific protocol, there's a guided awakening to not just simply wake the person back up immediately after this kind of momentous event, but guide them and slowly bring them back to reality. So, and also it's important to mention that people are aware in this hypnotic state. They're fully aware and sometimes even able to communicate verbally, as she reported. So, what does it require, or what is required of you to become a hypnotherapist? With most legitimate governing bodies, you need a bachelor's or higher degree in psychology, human services, or a healthcare specific discipline. In addition to that, you need to be somehow involved in healthcare, whether it is a registered nurse, you're a licensed psychologist, and others as well. Plenty of others. It requires about 40 to 100 hours of coursework from an accredited body. These include the American Association of Professional Hypnotherapists, the American Society of Clinical Hypnosis, and the Society for Clinical and Experimental Hypnosis. The certification after you've completed your coursework lasts for about 4 years. And during that 4-year period, clinical hypnotherapists are required to take 50 hours of continuing education in order to maintain their certification. After a little bit of research on the U.S. Bureau of Labor Statistics, I found out that their category of other therapists, which hypnotherapists would fall under, make a median of $57,410 annually as a salary. Again, that's kind of a general statistic because it wasn't specific to hypnotherapists, but it's kind of the best that I could come up with in terms of what they make. So the effectiveness varies by diagnosis. As Heather will talk about, depression has shown some efficacy, or treating depression with hypnotherapy has shown some efficacy. There's been less concrete evidence with, say, smoking cessation and weight loss. So more behavioral changes have less consistent results in the research. Problem with the research is that a lot of it is over 10 years old, and a lot more is required, as we'll see in the next couple slides. So, as I said, it's most efficacious with depression. I came across several studies that have shown at least equal improvement as cognitive behavioral therapy in objective measures. So the way they do these experiments is that they'll give them a bunch of standardized tests at the beginning of the 16 to 24 week span, and then more tests along the way, and a test at the end of the time period, and in some studies a test years down the line to see how it continues to affect them. So these studies are usually small, maybe 50 to 200 participants, and like I said, they last between about 16 to 24 weeks with a minimum of 1 treatment session per week. As far as anxiety, hypnotherapy shows some promise with anxiety, but the current research is generally inconclusive, so more is necessary. With surgery, pre-surgical and pain, it has been shown that there's some activation of dopamine pathways in the brain without opiates, and does help with people heading into therapy and objectively recovering physically from the therapy, and their mindset after the therapy as well. But this is also something that requires more research. I came across about 2 studies in this area. And then there's irritable bowel syndrome, which the American Psychiatric Association referenced a study saying that 58% of men and 75% of women in the study reported immediate relief in their irritable bowel syndrome after 12 weeks of sessions in hypnotherapy, and 80% reported initial relief, that they felt the relief 6 years down the line as well. This is Heather Freilich. She is the certified clinical hypnotherapist that I interviewed. Sorry that one line is kind of jutting out into her picture there. Heather specializes in anxiety because the impetus for her receiving her first hypnotherapy session was her own anxiety when she was in school. Heather says that hypnotherapy, the difference between hypnotherapy and cognitive behavioral therapy is that hypnotherapy is about the subconscious mind matching the conscious mind. She says that habitual behavior change happens at a subconscious level, and that most traditional therapies focus only on the conscious mind. Heather says that the keys to saying a good hypnotherapist is meditation to de-stress and prepare to lead these treatments that require kind of a calming voice, and that compartmentalizing work and home life is very important, so she doesn't bring her own issues into the workplace and into her sessions. Heather won't treat patients with ulterior motives or criminal intentions. In the interview, she referenced a patient who wanted to learn how to beat a lie detector because he had molested a family member. So she's obviously very sensitive to issues like that. I am going to show you about a 3-minute clip of this interview talking about leading sessions for various diagnoses, and Heather addresses skepticism on hypnotherapy as well.
Money. But that said, sometimes the longer people do it, the more benefit they get.
Okay.
So,
And does the approach change based on the symptom, or is it pretty much kind of the same?
so I tend to meet, the way that I think of it is I meet people where they are. So whatever's going on for them that day, and whatever comes up, is what we deal with. Some people are very focused on, they're like, I just want to work on weight loss and I don't want to talk about
Okay.
anything else. So, but I have protocols. So with hypnosis, so the talking part, the sessions are about an hour to an hour and 15 minutes.
Okay.
The first part of the session, like the first half hour or so, we spend talking, going over the issues, what's going on, if they're a returning client, what's happened for them, that kind of stuff. I use that information for the hypnosis. So, but the protocols, I have hundreds of protocols that, depending on and because I've been doing it so long at this point, I just know what they are. And so, depending on what they tell me, I'll be like, oh, I think I'll do that with them today. But when you first start out, you have scripts and protocols that you use.
Okay. What I found interesting, and what I don't think a lot of people know, is that hypnotherapy became an accepted therapy by the American Psychological Association in 1960, I think.
Yeah.
But
Yeah.
I would think that you may still deal with a fair amount of skepticism from people. Have you treated anyone that's kind of come into it reluctantly, or maybe they've been referred to by someone and maybe they don't want to be there, and does your approach change for those people?
Well, so I will say that the nice thing about, well, how do I want to say it? Versus going to a traditional therapist where someone's like, you need therapy, and they kind of force you to go. People, it's people come to hypnosis because they have an interest in it, or they see something, they read about something that maybe an issue they have, and maybe someone says, oh, hypnosis worked for that. And so I say most people come in like as a skeptic, or have some skepticism, or hesitancy, but most people are wanting to do it. There have been some people over the course of my career that maybe their wife made them come in, but it was like to quit smoking.
Okay.
So, and it's worked really well, but not for all of them. So it definitely works better if it's someone that's interested in it and wants to do it and believes in it, but it can work just as well for people who don't.
Gotcha.
So
Okay. And like you said, I would think.
So there, Heather refers to, maybe not intentionally, that the power of suggestion is important in her treatment of people that are that buy into the therapy. So, all right, that's it. I appreciate your attention, and hope you enjoyed it. Thanks.
A clinical therapist.
Here's my reference page.